There's something I say to my patients almost every week that surprises them. Just because your blood pressure is high does not automatically mean you're doing something wrong. I know that sounds backwards. You've been told your whole life, eat better, exercise more, cut the salt, and your numbers will come down. And you did those things. You walk every day. You gave up the chips. You're careful. You're trying. And you're still sitting in your doctor's office watching that cuff squeeze your arm, and the number comes back high. Again. If that's you, if you've ever felt like your body is just ignoring everything you're doing, I need you to hear this. You're not failing. Your body is not broken. There are real medical reasons why blood pressure stays stubbornly high even in people who are doing the right things. And most of them never get talked about. I'm Dr. Blackwell, by the way. I've been in practice for 7 years, and this one comes up in my office more than almost anything else. Today, I'm going to walk you through the 5 hidden reasons your blood pressure won't budge, and more importantly, what to actually do about each one. No generic advice. No, just eat less salt. Real answers. If that sounds like something you need to hear, drop me a comment. I want to know how many of you are dealing with this exact frustration. Let's get into it. So let me tell you about a patient. I'm going to call her Gloria, 67 years old, retired teacher, walked 2 miles every single morning, cooked most of her meals at home, didn't smoke, barely drank. She was doing more than most people half her age. And her blood pressure? 152/94. Consistently. Her previous doctor had already put her on lisinopril, then added amlodipine, then bumped the doses. And Gloria kept coming back with the same look on her face, this mix of frustration and guilt, like she was somehow letting everyone down. She told me, "Dr. Blackwell, I'm doing everything I'm supposed to. What am I doing wrong?" And I looked at her chart, and I looked at her, and I said, "Gloria, you're not doing anything wrong. We're just not looking in the right places." See, here's what nobody had checked. Nobody had asked her how she sleeps. Nobody had tested her aldosterone levels. Nobody had looked at whether her kidneys were sending the right signals. Because the standard approach to high blood pressure is lifestyle changes, then medication, then more medication. And when that doesn't work, most of the time, the answer is just more medication. That's not good enough. So let me give you the first thing you can do right now before we go any further. And this one is free, takes 5 minutes, and could change everything. Check your blood pressure at home, not just at the doctor's office. Here's why this matters. There's a real medical condition called white coat hypertension. Your blood pressure goes up just because you're in a medical setting, the anxiety, the stress, the weird smell of the waiting room. A study out of the University of Alabama found that up to 25% of people diagnosed with resistant hypertension actually had normal pressure at home. 25%. 1 in 4. So before you add another pill, before you change your whole diet again, check it at home. First thing in the morning, before coffee. Sit down for 5 minutes. Feet flat on the floor. Then take the reading. Do this for a week and bring those numbers to your doctor. That one step could change your entire treatment plan. Okay, now let's talk about the 5 real reasons your blood pressure might be staying high, even when you're living right. Number 1. And this is the big one that almost nobody talks about. Sleep apnea. If you snore, and I mean really snore, the kind where your partner nudges you or moves to the other room, this could be the single biggest reason your blood pressure won't come down. And you might not even know you have it. Sleep apnea means your airway closes off while you sleep. Over and over. Sometimes dozens of times an hour. Every time it happens, your oxygen drops. And your body panics. It floods your system with stress hormones, adrenaline, cortisol, and your blood vessels clamp down. Your blood pressure spikes while you're asleep. Now here's the kicker. This doesn't just happen at night. That nightly stress response resets your body's blood pressure thermostat. So even during the day, even when you're awake and calm, your baseline stays elevated. There was a major study that found that over 80% of people with resistant hypertension, meaning their blood pressure doesn't respond to 3 or more medications, have sleep apnea. 80%. And a lot of them didn't know it. So if your blood pressure won't come down, and you snore, or you wake up tired, or you get headaches in the morning, ask your doctor about a sleep study. This is a huge one. Comment yes if you snore and didn't realize it could be connected to your blood pressure. Not the details, just yes if that hit close to home. Number 2. Your body might be making too much of a hormone called aldosterone. Now, this one's a little technical, but stay with me because it could be the missing piece for a lot of people. Aldosterone is a hormone made by your adrenal glands, those little glands that sit on top of your kidneys. Its job is to tell your kidneys how much salt and water to hold onto. When it's working right, it keeps your fluid balance in check. But in some people, the adrenals pump out too much aldosterone, way more than they should. And when that happens, your kidneys hold onto too much sodium and too much water. Your blood volume goes up, and your blood pressure goes up with it. This condition is called primary aldosteronism. And here's why it matters. The Endocrine Society estimates it affects around 20% of people with resistant hypertension, 1 in 5. But here's the real problem. Most doctors don't test for it unless you're already on 3 medications and nothing's working. By then, you've been living with uncontrolled blood pressure for years, doing damage to your heart, your kidneys, your brain, damage that didn't have to happen. A simple blood test, the aldosterone-to-renin ratio, can flag this. It's not expensive. It's not hard to do, but you might need to ask for it. Number 3. The salt problem isn't what you think. Okay, you cut back on salt. You stopped adding it to your food. You switched to low-sodium everything. Good. But here's what most people don't realize. About 70% of the sodium Americans eat doesn't come from the salt shaker. It comes from processed and packaged food. Bread, canned soup, deli meat, salad dressing, cereal. Even some medications have sodium in them. The AHA recommends staying under 1,500 milligrams a day if you have high blood pressure. That's about 2/3 of a teaspoon of salt. Total. For the whole day. Most Americans are getting more than double that without even realizing it. So you might think you've cut salt. But if you're eating any packaged food at all, you're probably getting way more than you know. And for about 1/3 of people, their bodies are especially sensitive to sodium, meaning even a little extra has a big effect on their blood pressure. This is called salt sensitivity, and it gets more common as you get older. The fix? Read labels. Look at the milligrams, not just whether it says low sodium on the front. And track it for a week. You'll be surprised. If that just clicked for you, if you're realizing you might be eating way more sodium than you thought, type clicked below. I want to know. Number 4. Your kidneys might be struggling and nobody told you. Here's something most people don't know. Your kidneys don't just filter waste. They're one of the main regulators of your blood pressure. They control how much fluid stays in your body, and they produce hormones that directly affect your blood vessels. When kidney function starts to decline, even a little, your blood pressure goes up. And this can happen slowly over years without any symptoms at all. No pain, no changes in how you feel. Nothing until it shows up on a blood test. The 2024 ESC hypertension guidelines specifically recommend checking kidney function in anyone with hard-to-control blood pressure. A simple blood panel, creatinine, GFR, and a urine test for protein can tell your doctor a lot about whether your kidneys are part of the problem. And here's the thing, if your kidneys are involved, the treatment strategy changes. Some blood pressure medications are better for kidney protection than others. Your doctor needs to know this. Now look, that's for real. Medical reasons your blood pressure might be staying stubbornly high. But your situation is unique. If you want something more specific to you, your numbers, your medications, your history, VIP members get personalized answers to their health questions. And if you really want to go deep, Ultimate members get an entire video built around their personal situation. Links are in the description if that sounds useful to you. Number 5. And this one's gonna surprise people. It's not what medication you're on. It's when you take it. There's been a lot of research on this. It's called chronotherapy. Your blood pressure naturally dips at night while you sleep and rises in the early morning. For some people, taking their blood pressure medication at night instead of in the morning can make a significant difference. Now, I want to be careful here because this is something you should only change with your doctor's guidance. Not all medications are appropriate to take at night. Some of them, especially diuretics, can cause problems if you take them before bed, but it's worth bringing up at your next appointment. Talk to your doctor before making any changes to when you take your medications. This isn't a do-it-yourself thing, but it is a conversation worth having because the timing of your medication could be the reason it's not working as well as it should. Comment asking my doctor if you're going to bring up any of these 5 things at your next appointment. I'd love to hear which one surprised you the most. So remember Gloria, my patient who was doing everything right and couldn't get her numbers down? After we talked, we ran the tests nobody had run before. And we found it. Her aldosterone was elevated. Not sky high, just enough to keep her blood pressure stubbornly above where it should be. Her doctor added a low-dose spironolactone, a medication that blocks the effect of aldosterone, alongside the medications she was already taking. Not instead of them, alongside them. 3 months later, Gloria walked into my office with a blood pressure of 128/78. First time in years she'd seen numbers like that. And the look on her face, it wasn't just relief. It was this sense of finally. Finally someone looked. Finally someone didn't just hand me another pill and say try harder. She told me I knew I wasn't crazy. I knew something else was going on. She was right. So let me leave you with this. If your blood pressure won't come down despite everything you're doing, don't just accept it. Don't just assume you need more medication or that you're not trying hard enough. Push for answers. Ask about sleep apnea. Ask about aldosterone. Check your sodium, the real number, not what you think it is. Ask about your kidney function. And talk to your doctor about medication timing. Bring this video to your next appointment. Write down the questions. Pull this up on your phone. The best outcomes happen when you and your doctor are working together, and sometimes that means bringing them information they haven't considered yet. If you found this genuinely useful, Super Thanks highlights your comment so my team can get back to you with a more detailed response. If someone you care about is struggling with this, a spouse, a parent, a friend, send them this video. That's the whole reason I make these. And if you want more of this kind of honest breakdown, no hype, no clickbait, just real information you can use, subscribe and turn on notifications. I put out new videos every week. Tell me where you are right now. Comment just learn this if any of this was new to you, already knew if you were ahead of the curve, or making changes if something in this video is going on your list for your next doctor visit. Bring this to your next appointment. You deserve answers, not guesses. I'll see you in the next one.